my name is Sarah Grace Hughes, and I'm a student nurse with Franciscan University. At the end of the exam, I'm going to ask you to repeat my name again. I'm going to do a head-to-toe assessment today, if that's okay with you.
Yes.
What is your name?
Gabriella Hughes.
How are you doing today?
Good.
Do you have any problems or concerns today?
No.
How old are you?
15.
What is your height?
5 feet and 4 inches.
And weight?
120 pounds.
Okay, she is a healthy, vigorous 15-year-old Caucasian female. Given her height of 5'4" and a weight of 120 pounds, she has a BMI of 20.6, putting her in a healthy weight category, given the appropriate BMI. Her dress, grooming, and hygiene are all appropriate. Based on my communication with her so far, her general demeanor shows that she is cooperative, animated, and responds appropriately to questions. Her speech is articulate, and she is alert. What is your full name?
Gabriella Elizabeth Hughes.
And where are you right now?
I'm in my home.
Okay, what day of the week is it?
It is Sunday.
Great, those were all very good. The patient is alert and oriented ×3. Her thought pattern is logical, relevant, and organized. Could you tell me who the president was before Donald Trump?
Barack Obama.
Good. How would you interpret the phrase, an apple a day keeps the doctor away?
Eating healthy helps you stay healthy.
Yes, that's right. Is there anything you would do to prepare to go outside if it were raining?
I would bring an umbrella.
Okay, great. The patient shows good judgment and abstract thinking. Her remote and long-term memory long-term memory is intact. Now I'm going to do your vital signs, if that's okay with you.
Yes.
Great. I'm going to take your temperature now. Okay. So I'm just going to stick this under your tongue a little bit further back. Okay. Your temperature is 97.9. Very good. The patient's temperature is within the normal range and is afebrile. I'm now going to take your pulse. Okay, so if you could just pull up your chair a little bit and put your arm on top of the table, face up, please. Or your other one, ideally. Thank you. So yeah, now I'm going to take your pulse. Okay. So. Okay, the patient has a pulse of 18 for 15 seconds. Okay, that gives you a pulse of 72 beats per minute. The patient's pulse is within the normal range and she is normal cardiac. Now I'm going to count your respirations. So just sit and breathe normally. Okay. Okay, I counted 4 breaths there during that 15-second period. So the patient has a respiration of 16 breaths per minute. The patient's respirations are within the normal range and are eupneic. I'm now going to take your blood pressure. So if you could put your arm up on the table again, please. And now. Stick your arms right here, please. Need that about an inch above elbow. Okay, put your arm up, facing upwards, please. The patient has a blood pressure of 118 over 66. Sorry. Okay, so yes, your blood pressure is 118 over 66. This is very good. The patient's blood pressure is normotensive. Are you having any pain?
No.
Good. I'm now going to examine your head and neck. So I'm just looking at the overall size of your head. Okay, and after just looking at that, I can see that the patient is normocephalic. I do not see any malformations of the head. Facial structures are symmetrical, and her hair is brown. Okay, can I examine your hair, please? I'm just looking for any lumps, bumps, or lesions. Okay. I'm not seeing any of that, and the patient's hair has appropriate texture and is not brittle. The patient has no bumps, malformations, and lacerations on her scalp. Do you wear glasses?
No.
I'm going to assess your eyes now, so please look right at my face so I can look at the alignment of your eyes. Okay. So the patient's eyes are properly aligned. Now I'm going to look at the prominence. Okay, so eyelids intersect at the appropriate level, so the prominence is appropriate. There's no ptosis, there's no exothalamus going on. I'm going to check your perla now, that your pupils are equally round and reactive to light and show accommodation. Okay, so just look at the bridge of my nose here, and I'm gonna just cast a shadow. Okay, the patient's pupils are equally round and reactive to light. Now I'm gonna check for accommodation. So if you could please just look straight ahead at that window until I tell you to look at the end of my pen. Okay, so just look at that and don't look at the pen. Okay, now look at the top of the pen. Okay, perfect. So the patient is perla positive. Now I would like you to look at my finger. I'm going to take you through the 6 cardinal fields of gaze. So just keep your eyes on the end of my finger. Okay. Perfect. Okay, on the EOMs, my findings show that cranial nerves 3, 4, and 6 are grossly intact. EOMs are positive. Now I'd like to take a look at your ears. So, look at those. Perfect. Okay, the patient's ears are symmetrical. And now I'm just gonna feel for any lesions. No, I don't feel any lumps or lesions. The patient has no lumps or lesions on the ears. You've been interacting with me well, so your gross hearing is intact. Now I'm gonna look into your ear canals. Just tell me to come around. Okay, that one looks good. Good. I see no wax or discharge in either ear. There's no redness or signs of infection. Now I'm gonna look at your nose, check for any congestion. So just, okay, the patient's nose shows no drainage or swelling and no septal deviation. So congestion is negative and drainage is negative. Do you have any difficulty breathing?
No.
Breathing is good, so there are no problems there. Now could you tell me your general sense of smell? Do you have any difficulty smelling odors or fragrances?
No.
The patient's smell is grossly intact. Now I'm going to look at your throat. So could you please open your mouth for me and cock your head back a little bit? Okay. And now just say ah. Okay. Perfect. After looking at the oral pharynx, all of the throat and the mouth, I can see the patient's mouth is pink, moist, and intact. I do not see any lesions or missing teeth. The patient does not have dentures. Do you have any loose teeth?
No.
Good. There are also no odors detected. I'm not going to do a gag reflex on you, but if I were going to, I would take a tongue depressor and slide that back on the tongue until the patient shows their gag reflex. Could you swallow for me, please? Perfect. The swallow was positive. Now I'm going to check your trachea alignment. Okay. So just sit up a little bit. Okay, the trachea is properly aligned and symmetrical all the way down to the sternal notch, which shows that the trachea alignment is good and midline. Now I'm going to check your lymph nodes. And just upon inspection, I don't see any lymphadenopathy. And now I'm just going to palpate and rub your lymph nodes. So first, the pre-auricular. Okay, nothing there. And now the post-auricular. And the occipital. Okay, and now tonsillar, submaxillary, and submental. Okay. And now the superficial cervical. And the posterior cervical. And the deep cervical. Perfect. And lastly, we're just going to check the supraclavicular. Okay, all lymph nodes were non-palpable. Was there any tenderness with that?
No.
Good. The patient was negative for tenderness in the lymph nodes. Now I'm going to check your carotid pulses. So we're just going 2 fingers below the Adam's apple and just feeling there. And now the other side. The carotid is present and strong bilaterally. The pulses on both sides were a 3+. These pulses were symmetrical as well, and the carotid is palpable. Now I'm going to auscultate your carotid to listen for any bruits. So can you take a deep breath for me and turn your head to the side, and then hold your breath. So just give me 1 second. Okay, so just, deep breath in and hold your breath, please. Okay, now can you take a breath and turn your head to the other side for me, please. Deep breath in and hold it, please. Okay, perfect. The patient showed no turbulence and no bruits bilaterally. So she is negative for turbulence and negative for bruits. Now I'm going to do a skin assessment on you. So I'm just going to feel the skin there. The skin that I can see has appropriate flesh tone. The skin is not dry and shows appropriate moisture. The texture is smooth. The temperature is warm, not hot or cold. Okay, I'm just going to check your skin turgor. So, perfect. Skin turgor is good, no skin lesions. Now I'm going to do your heart assessment. So could you please lay down for me on this table? Okay. So now I'm just going to look for any pulsations. Okay, pulsations are negative. Now I'm going to palpate for any pulsations. So first we're going to come to the right second intercostal space and your aortic, pulmonic, Erb's point, fourth intercostal, fifth intercostal, and the PMI. Okay, first pulsations were felt at the PMI, the point of maximum impulse. I'm now going to expect for pulsations. I'm just gonna observe your chest across. Okay, the patient is negative for heaves and lifts. There's no evidence of cardiomegaly. Now I'm gonna assess your chest for pulsations and thrills. So now I'm just gonna go from the second intercostal space, the angle of Louis, and first start with your aortic, 2, feel there, any thrills, okay, and then your pulmonic, thrills. Pulsations are negative and thrills are negative on both the aortic and pulmonic. Now, Erb's point, thrills. Pulsations are negative and thrills are negative. Fourth intercostal. Pulsations are negative. Thrills are negative. Now, the fifth intercostal. Also the tricuspid auscultatory site. Pulsations are negative, thrills are negative. And now the fifth intercostal at the midclavicular line. Pulsations are positive and are felt in the fifth intercostal space, and they have the same rate and rhythm as the vital signs. The rhythm is regular and the intensity is strong. The diameter is about 2.5 centimeters, which is appropriate. The duration is a faint tap, which is appropriate. Just feeling for thrills. Patient is negative for thrills there. Okay, now I'm going to listen to your heart. Okay. So now I'm just going to listen to your heart, second intercostal, aortic. Pulmonic. Erb's point. Fourth intercostal. Fifth intercostal. Just checking for VSD here, ventricular septal defect, and PMI at the midclavicular line, the fifth intercostal space. Okay, perfect. Those were all great. They all sounded good. No extra sounds or murmurs. Appropriate relationship of S1 and S2. S2 was loudest at the top, but as I worked my way down, S1 became louder. Heart rate was consistent with vital signs. Rhythm was regular. Strength of the heart was strong. No extra heart sounds. There was also no JVD detected while she was laying down. Could you sit up for me, please? Okay. I'm now going to do the lung and thorax assessment. So, now I'm just gonna look at your size and structure. Okay, the patient's thorax is appropriate in size and structure and shows symmetry, and negative for any deformities. I'm just going to check the AP diameter now. Breathe in, just normally. Okay. And that is appropriate AP diameter, and there's no, she's negative for barrel chest. Now I'm just gonna feel here. Okay, there's symmetry in the shoulders and clavicles as they hit at the same level. Now I'm just gonna palpate your sternum from the sternal notch right here to the xiphoid process. Okay. Perfect. Could you take a deep breath in for me, please? Okay. There's good lung expansion there. Respiratory excursion is deep, symmetrical, and appropriate. Negative for lesions on the thorax. I'm gonna check your spine and S curvature now, so just stay there. I'm just gonna move your hair out of the way a little bit. Just gonna palpate down. Okay, just sit up straight, please. Okay, yes. No deviation for asymmetry. The patient is negative for scoliosis and has appropriate S curvature. Shape is appropriate. Okay. Now I'm going to listen to your lungs. Could you turn to your head to just the side for me just a little bit? And then just breathe deeply through your mouth, but no quicker than normal. Okay, you can breathe normally now. The rate was consistent with your vital signs. The rhythm was regular. The depth was deep because I asked you to breathe deep. Effort was non-labored, negative for use of accessory muscles. No adventitious breath sounds. Your lungs were clear, even, and easy. No crackles or wheezes. Now I'm going to listen to your lungs posteriorly. So if you could give yourself a hug and breathe deeply through your mouth, but no quicker than normal, that would be great. So we're just starting right off of C7. Make sure you're getting the spots in. Come to the side so you can see the spot. Okay, you can breathe normally now and let go of that. Okay. The rate was consistent with vital signs. The rhythm was regular. The depth was deep because I asked her to breathe deeply. Effort was non-labored. Use of accessories was negative. Also negative for adventitious breath sounds. Now I'm going to assess your abdomen. So could you please lie down for me? Okay. Are you ticklish at all?
Yes.
Okay. Now I'm just going to check your belly. So I'm just going to palpate across. Okay, that is nice and pliable. I'm gonna inspect the abdomen now. So I'm just gonna look for any pulsations or distension. Okay, the patient is negative for distension and negative for pulsations. The abdomen is soft and non-tender. I'm gonna listen to your bowel sounds now. So I'm just going to look in one quadrant. I'm going to be listening for a whole minute. Perfect. You were healthy. You have healthy bowel sounds that were at 16, which is a normal rate. The patient shows normal active bowel sounds that were within the 5 to 34 range. Now I'm going to percuss your abdomen to make sure that there's tympany throughout and no dullness. Okay. And now I'm just going to palpate your abdomen. And since you're ticklish, I'll just take your hand to hopefully prevent that sensation from happening. And I'm just gonna go light and then deep, light, deep, light, deep, light, deep, light, deep, light, deep, light, deep, sorry, light, deep, light, deep, light, deep. Okay. That was all very good. Was there any tenderness when I did that?
No.
Good. I did not feel any lumps or enlarged organs, so there is no organomegaly. The bladder was non-palpable. There's no abdominal distension, and she has a flat abdomen. Also, I heard tympany throughout when I was percussing. Okay, could you sit up for me now? I'm gonna do the musculoskeletal assessment. Okay, are you having joint pain anywhere in your body?
No.
Okay, that's good. Any stiffness anywhere?
No.
Good. Everything looks symmetrical. There's no deformities in the bony structure, and the patient reported no stiffness. Are you experiencing any difficulty with moving any joint?
No.
Are your Are both your upper and lower parts doing okay?
Yes.
Great. When you're working and you're moving those joints, have you noticed any crunching or crackling sounds in the joints?
No.
Good. By my assessment and the patient's report, there are no problems in the joints. There is no joint deformity, pain, limitations, or crepitus in the extremities. Now I'm going to assess your extremities. Could you put your hands on your legs and your lap for me, please? So I can see appropriate flesh tone throughout the upper and lower extremities. Now I'm just gonna can you flip your hands for me, please? Perfect. The temperature is appropriate and warm. I'm gonna check your radial pulses now. Okay, pulses are present and strong. I would give them a 3+. They're intact and symmetrical. Now I'm going to check your posterior tibial pulses. So just right back here. Perfect. So posterior tibial pulses are present and strong, giving them a 3+. They are intact and symmetrical. Now I'm just going to check your dorsalis pedis pulses. Okay, so just right about there. Perfect. The dorsalis pedis pulses are present and strong, giving them a 3+. They are intact and symmetrical. Now I'm going to check your capillary refill, so just put out your fingers. Doesn't matter. Actually, can you put your fingers just flat? Thank you. Okay, perfect. That's great blanching, definitely under 2 seconds. Same with those. Great. Now let me check your toes. Good. 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 Great. Okay, patient's capillary refills were less than 2 seconds on both thumbs, middle fingers, pinkies, big toes, middle toes, and pinky toes. Her capillary refill on all of those were brisk capillary refill shown in both upper and lower extremities, and no cyanosis noted. Now I'm just going to look and see if there's any edema anywhere. I don't see any at all, so no edema in all extremities. So no need to check for pitting. Now I'm just gonna check the bony prominences, the bony prominences and tendons. So just perfect. Bony prominences are all good. Tendons are all good. Now I'm gonna do a neurological assessment. Okay. So now I'm just going to cross my fingers. Could you wrap your hands around my fingers, please? And just squeeze them. Good, that's great. So she has a good grip. Now, can you grab them again and then pull them towards you? And then push them away. Okay, good. The patient has good strength bilaterally in upper extremities. Now for your lower extremities, could you push against my hands? Good, and now pull. Great. The patient has good strength bilaterally in the lower extremities too. Okay. So the strength to the upper and lower extremities bilaterally is strong and intact, and there's proper muscle bulk and tone to upper and lower extremities as well. To check your coordination, could you walk over to the fireplace and back, please? Okay, you can just sit back on the table now. I can see that she is swinging her arms, so there's no evidence of Parkinson's disease. The patient's gait was smooth and coordinated, which is good. No ataxia, no balance problems, appropriate posture. All of her movements show that she has full range of motion. Are you having any sensory problems or problems with sensation?
No.
Good. Any hot or cold sensations, numbness and tingling?
No.
Great. Any problems with pain stimuli?
No.
Good. The patient has good sensation and appropriate sensory discrimination. I'm now going to check your deep tendon reflexes. So, could you just flex your arm for me quick? Okay, good. So, if you could put your hands up just on your leg. Just going to go right here. Good. Good. Now the patellar tendons. Good. Good. Okay, the patient has 2+ reflexes, bilateral in the bicep tendon and the patellar tendon, which is appropriate. Okay, so the biceps reflex and the patellar reflex are intact. Okay, at the beginning of this exam, I told you my name. Could you repeat it to me now?
Sarah Grace.
Okay, so the patient's recent memory or short-term memory is intact. Okay, that is it. Thank you for being my patient today.
Thank you.